In 1985, a group of activists determined to build a healthcare system that worked for everyone in Massachusetts came together to form Healthcare for All. Over the next 40 years, the small organization they founded has gone on to do big things. Working with our allies, coalition partners, and supporters, we've had some incredible successes and some crushing setbacks. But through it all, the story of Healthcare for All has been a story of persistence. Because our predecessors kept pushing for progress, even when it meant swimming against the tide, Massachusetts is the national leader in health coverage and access. Now, as we celebrate Healthcare for All's 40th anniversary, we are once again swimming against the tide, faced with the specter of a federal government bent on dismantling everything we've worked so hard to build. When they look back on this moment 40 years from now, will our successors lament that we allowed decades of progress to be turned back? Or will they celebrate the fact that we continue the story of persistence and rose to meet the moment? When we come into the office every day, we are writing the next chapter in that story of persistence. Because for all of us at Healthcare for All, it's more than just a job. Now, more than ever, persistence is personal.
When my parents first arrived to this country, English wasn't their first language, and it took some time for them to learn English and navigate all the systems that come with moving to the United States. So since a young age, since I was 6 years old, I was acting as their mediator, their translator, and their advocate, because I saw the challenges that they faced and I wanted to make it easier for them. At the helpline, we receive calls from people all over the state of Massachusetts. We help people who speak Spanish as their primary language, or Haitian Creole, or Portuguese, or French. And one of the things that we hear very often is just, how do I even get to a healthcare plan that I can afford? There's so many options. It's really confusing to know what option is best for you. It can be really confusing and challenging, and it ultimately could lead to them not actually going for the healthcare that they need. So our job is to make it easier and more accessible. I look back at what HCFA has done over the past several years, decades, and I'm just inspired and motivated. So it means so much that there's this amazing history that can keep us going for the future.
I actually came into Healthcare for All looking to continue that kind of social justice belief that I have, and I'm able to do that every day in my work. Before I started Healthcare for All, I was uninsured myself, and it was before the new law went into effect. I had a couple of hospitalizations, racked up some bills, and then I got a call actually when I was in the hospital from Healthcare for All about my job, and I was lucky obviously to land here and get good health insurance through Healthcare for All. But then I saw what a difference the new programs that Healthcare for All had advocated for, that were just putting into place, and how they helped people that would have been in a position like me, who were uninsured but working at the time. We work with partners of all different types of organizations, and we try to influence state lawmakers and decision makers to make healthcare better for people and make more consumer-friendly decisions. Right now, I know that Healthcare for All really needs to be a leader to make sure that we don't take steps backwards, given that the environment that we're in, and Healthcare for All is stepping up and being a leader in that. Just hoping that we can continue to go down the road of making progress towards Healthcare for All.
So in my head, there are two important things in anybody's life. One is the environment, and the other one is health. And when I was trying to figure out, my next step, I'm like, it's gotta be one of those two things. Because I've been hearing from Healthcare for All since, I first came, and I've been looking through the history when I had the opportunity to come and work for Healthcare for All. It was so exciting too. It felt like I'm joining the movement I'm in right now, and there's so much more that we can do. I see how difficult it is for people to access care. So who right now is having more problems with high blood pressure, diabetes, and other chronic disease, right? Are the folks that have less access, that are less able to trust a system, are less able to afford a system. So that's where healthcare for all comes in, making sure that there are these structures in place that guarantees that healthcare access to everybody, not only to the folks that have the means. What is more important in life than having your health, right? If you have your health, you have everything.
Agora, mais do que nunca, healthcare for all.
Kunia, plus que jamais, healthcare for all.
Ahora más que nunca, healthcare for all.
Now, more than ever, healthcare for all.